If you've ever felt better or had your pain go away for a few weeks after a treatment, and then the same problem came back, or a different problem showed up in a different part of your body, then this video is for you. Now, I've spent 35 years in clinical practice treating chronic pain, and I want to tell you why most therapy, including a lot of what I have done myself, gets people about 60% of the way there and then stops. Now, before I tell you the story, I made a free resource for people watching this kind of video. It's called the Awaken Your Inner Healing Power Toolkit. The link is in the description below. Take it. I started practicing in 1987 in Westport, Connecticut. I was an acupuncturist working out of a naturopathic office. I had what I called beginner's luck. Most of the people who walked in the door got better. Some of them got dramatically better. Now, they came in with chronic back pain, chronic headaches, joint pain, uterine problems, addictions, many other conditions that they'd not been able to get help with anywhere else. And the work I did with them held up. By the standards of how the profession measures success, I was doing well. And then a strange thing started happening. The people I'd helped started coming back. Not all of them, not right away, but a high percentage within a few weeks, a few months. Sometimes the same problem returned. The same shoulder that had stopped hurting started hurting again. The same migraine pattern that had quieted down started up again. Sometimes it was a new problem in a new part of the body. The shoulder was fine, but now is the lower back. The migraines were gone, but now is digestive problems or insomnia. Now, I want you to picture this clearly, because I think a lot of you have lived this from the other side of the table. You go in, you get better, you feel relieved, you think it's finally over. Phew! But then a few months later, something else shows up, or the same old thing shows up and you start over again. The clinical word for this is recurrence. The honest word for it is whack-a-mole. You hit one symptom and another symptom pops up somewhere else. Now, I want to be very honest with you about what I saw in those early years in Westport. Now, I knew this pattern was considered normal in my profession. I knew it was what kept people like me in business. If a patient got better all the way and never came back, that patient is no longer paying your rent. Now, the whole structure of healthcare, alternative healthcare included, assumes a steady stream of returning patients. Recurrence is not a bug, it's the business model. But I was not satisfied with it. I was not willing to make my living on people half fixing. So I started looking for the part I was missing. I went deeper into the body. I added energy-based modalities to my acupuncture work. I built better tools. I started using microcurrent therapy. And within a few years, I added color and sound to it. I got more sophisticated, technically speaking. And my results did get better. People who had been suffering for decades started getting relief that I could not have given them in the first 5 years of my practice. But here's the thing. Even with the better tools, even with the more sophisticated techniques, even with everything I added, the pattern did not fully go away. Some of my patients got about 60% better, but not the rest of the way. Some of them still came back 6 months later with something new. Now, that's when I started looking not just at the techniques, but what the techniques were missing. Now, I'm not going to tell you the answer in this video. The honest reason is that the answer takes more than this video. But I will tell you the question that finally cracked it for me. The question was not, what is wrong with this patient's body? I had been asking that question for about 10 years. And I had good answers for it. The new question was, what is this body holding that no technique is reaching? Different question, completely different floor of the building. Now, when you ask the first question, you treat what you can see. Now, when you ask the second question, you start to notice the part of a person that's doing the holding. And you notice that the body of a person who's doing a lot of holding does not stay better, no matter how good your techniques are. This is why most therapy gets people 60% of the way there, because most therapy is built to address what is on the surface, called symptoms, what people complain about. And what most chronic pain patients are carrying is not on the surface, it's being held by them, often without their awareness. And the body is the place where that holding shows up. We could say it's at a deeper level. So if you've been in and out of treatment for years, and you cannot understand why nothing fully takes, then this is why. It's not because you failed treatment. It's not because you're broken. It's not because nothing works. It's because what actually is keeping the problem in place has not been touched by what you have tried so far. Make sense? For now, the question I want to leave you with is this. If everything you have already tried has gotten you 60% better, or whatever the percentage is for you, but no further, and what if the missing 40% is not another technique or another professional you go to or another book you read? What if it's something else entirely? Now, if you've been through the cycle I'm describing, getting better, then back, then better, then back, tell me that in the comments. I want to know what you've tried and what you've been through. And again, you can get your Awaken Your Inner Healing Power Toolkit. The link is here in the description. Start there if any of this is landing for you. Now, next week, I'm going to tell you about a woman named Alex. She's had insomnia since she was 6 years old. She's now in her 60s. She's tried, by her count, almost every treatment available over more than 50 years. Her husband's a doctor, but none of it gave her any sustained relief. I want to show you what we found in her body that nobody had ever named for her in 54 years of treatment. I'll see you there.